Okay, welcome everyone to the Kaps nursing classes, where I will be taking an initiative to teach for free of cost NCLEX-R for the NCLEX-RN examination. So this course will be for free, available on the YouTube. So if you are the first time on this channel, I highly recommend subscribe this Kaps nursing classes, and don't forget to hit on the bell icon so when I post the video next time, so you can see my video next time when you click on that button. Okay, so now without wasting the time, let's get into. So for the NCLEX-RN examination, remember, what do we need? We need two things in total, right? The one is the content and the second is test taking strategies. So which thing is more important? Which thing is less important? Which thing we are going to work here in the Kaps nursing classes? Let's talk about it a little bit. So I would say both are equally important, but in my opinion, test taking strategies are a little bit more important as compared to just knowing the nursing content. Nursing content, we all go through being as a nurses in the nursing school. We all know about the nursing content. But the problem is when you go to the real exam, a lot of time I have seen the nurses, they are complaining, we don't know how to apply the content into the question. And sometimes, even if you know the content, but still you cannot find out the right answer because every answer seems very nice to you, right? So we call test taking strategies to them. So test taking strategies where you actually need such a practical strategy which you do apply into the question and you find out the answer for that question. So I personally feel test taking strategies, they're actually, you really need to know about 70% for this examination, like how to handle every type of question in the NCLEX, and about 30% the content you really need to know to find out the answer for that question. Now, why 30% content? Why 70% test taking strategies? As I said, even if you know the content, you still most of the time cannot find out the answer for that question. So today we will talk about test taking strategies, and this is the first lecture. If you're watching, this is the first lecture on the test taking strategy, and today I'm going to teach you a very basic, which I personally feel every nurse needs to know to answer any type of question in the NCLEX-RN. This is just, I feel like it's a 4-step technique. What I call is a 4-step technique, because there are 4 steps what I feel like there needs to be when you read any type of question for your exam. Now, this 4 types technique, let's see into what it is. So remember everyone, as I said, this technique is very helpful. I have seen 100% this is very effectively, like if you really understand how to apply this technique into the question. But remember, accept case studies. For the NGN, case studies. Just case studies, you cannot apply this technique. But yes, there are lots of techniques available which you can apply on the case study as well to find out the right answer. And I will be uploading those strategies for the case studies in my upcoming videos. So that's why don't forget to subscribe my channel, and also please watch this video until the very end so you really find this video helpful for yourself to write down the NCLEX-RN exam. Especially I would say if you're a repeat test taker, you will really get to know what I'm talking about in here. Okay, now let's get started. So this is 4-step technique, what I called. Now, the first step you have in this one is read the complete question in the exam. You must be like, Kaps, this is what we do all the time. Even when you're practicing at home for your NCLEX-RN, you read the complete question. But I have seen lot of time, 99.9%, what the students does, they keep rereading same question again and again, right? So please do not read the question again and again, because you will get a lot of time chances, to read the question back and forth again and again to find out the answer. So in the first step, please read it only once, okay? So only once you need to read the question, and I'm going to apply this technique by using an example on the right side very soon. So don't look at the question first, understand the technique first, and then I will go over one by one thing with you, okay? So when you're reading the question, I have seen majority of the time nurses, they focus on such a lot of stuff which you don't need it actually to find out your right answer, okay? It's very rare exceptional cases where you need to come back to find out that particular information, otherwise you really don't need it. And I can prove you with a lot of questions in my upcoming video, you will know what I mean to say in here. So the first thing I have seen, which you can easily eliminate when you read the question, is name of the patient. You really don't need to know the name of the patient when you find out the right answer for your NCLEX-RN exam. Does that really matter if you're taking for example, Mr. X or Mr. Y? Your answer will be still the same. When you're caring as a nurse, your answer will be still the same what you're going to do first for that particular patient in that particular emergency, right? So name of the patient, don't focus too much. Age of the patient, don't focus too much. Even the diagnosis of the patient, do not focus too much. I have seen a lot of repeat test takers when they come to me, they try to find out the right answer based upon the diagnosis into the question, okay? But remember, you only look at the diagnosis if you need it. You only look at the age of the client if you need it. For example, maybe you need to see the age if it's 10-month-old, if it's 1 month old, 1 year, 15 years, 65-year-old, to find out the age appropriate choice maybe, or the age appropriate particular. It's a theory based question, you're trying to finding out the answer. Then you really need to know the age. Otherwise, you do not need the age of the patient. And even the diagnosis also, as I said, you only look at the diagnosis if you need it, okay? And definitely I will bring some questions as well in my upcoming videos where you will stuck between the two options and you might need to look at the diagnosis over there only if it's needed. But in the first glance, don't look at the diagnosis too much. Just keep reading, skim and scan. Now, another thing is past history. Don't look at the past information, patient arrived and emerged at this time particular. That's all the past information. You look at the present condition, what's going on into the question. That is more important, I would say, as compared to the past history. Again, you only look at all these information into the question if you really need it, okay? Now, the second step, what we have is, after you read the question only once, most of the time, I know nurses, you might be thinking like, if we read the question only once, then how do we know what the question is asking? Actually, we still have to go back to the question, right? Well, I would say you do apply step 2, step 3, and step 4 and see if that's helpful for you or not. So the second step here is find the keyword into the question. Find the keyword. Now, majority of the nurses I know, they do not know what the actually question is asking from them. Keyword finding is very, very, very important, okay? And I'm going to tell you this rule today, how to find the keyword into the question. The keyword, always remember, it's always hiding before the last line of the question. Before the last line of the question, right? Now, I have not even read this question yet, but I'm going to show you still where the keyword is hiding is, right? Before the last line of the question, right? So before the last line means not this particular last line. The last line means after the full stop, okay? You actually look from the full stop, the last line. So for example, in this question, if you see from the backwards, I do not find the full stop yet. This is just the comma. We do not include the comma. You look at where the full stop is. Now this is the full stop, I can see, right? I have not even read the question yet. So now this is the full stop. And as I said, your keyword is hiding before the last line of the question. So if my last line is actually starting from this place to until this place, right? So if this is whole thing is the last line, whatever they are talking about in here, that means the keyword is right before this full stop. Yes, right before this full stop. Whatever the word you will see in here, that is actually your keyword of the question. Until unless, remember, if it's a patient name or something else that doesn't make sense to you, or an incomplete grammar sentence, definitely the rule is you can go back a little bit into to find out where the actual keyword is hiding until it starts making sense to you. Okay, so let's see together with me. I have not read even the question still yet. Before the full stop, I can see the word says process, right? What process? Process could be anything in the word, right? That is not the actual keyword. That means I need to go back a little bit back in there to find out my keyword. But what if it says vital signs here, something, blood pressure? Yeah, that is the keyword because it's already making sense. You have a patient in front of you whose vital signs is 98/50 and so and so. That is the keyword. But process word cannot make a sense itself as a keyword. Now, to complete this one, you need to look at the next word to it. It says thought process. What thought process? Again, it's an incomplete word. What thought process? Everybody has a thought process. I don't know thought process. They're talking about normal, abnormal. What thought process or what kind of thought process they're talking about? So you still have to go back into here. Now they said disturbed thought process. Okay. Now I can see a little bit meaning in here. Experiencing disturbed thought process. Okay, hold on. This is your keyword now. Now, why we stop in here? Because it already making sense to you, like disturbed thought process. That means if somebody already experiencing like disturbed thought process, the question is actually on that particular keyword now. Okay, so you just noticed I did not read the whole question yet, but still I will apply the rule number 1 very soon with you. But I just wanted to show you quickly how to find out the keyword. And always remember, as I said, keyword is always hiding before the last line of the question. Until unless, if it doesn't make sense to you, then you go back a little bit in there just to finish your complete grammar sentence. Okay? But if it's already making sense to you, that actual medical or nursing word or terminology, then you keep that word with you. Okay? So now, once you find the keyword, the number 3 is read the last line of the question. Nurses, this is very important. Like why I'm showing you step 1, step 2, step 3, because I have personally seen like majority of the nurses, even before I find out this technique with my experience in myself, like everybody just like blindly read the whole question and then you don't know the answer, you still read the question. You don't know the answer, you still read the question. Again answer, again question. So I personally think if you really apply this step 1, 2, 3 and 4 technique to find out your answer, I can guarantee you can find out the answer for that particular question. And if it doesn't work for you, feel free to let me know in the comment section. Why? Because I have a lots of techniques like this. If one technique doesn't work with you, I can give you the second technique after. Okay? So now the third one says, read the last line of the question. Now after you finding the keyword, you need to read the last line of the question. Why reading last line is important? Because remember, in the NCLEX, every word in the last line that actually tells you what the question really demands from you. So for example, the words like first, priority, best, most important, initially and so and so. So these words, when you look at in the last line, every word has a meaning in itself. Immediately, right? Most concerning, it could be a lot of words, I would say, and definitely I will bring a different lecture on these words as well. And as I said, don't forget to subscribe this channel, because one day I'm gonna bring a lecture and I will be breaking down all the words as well, telling you exactly if they give you this word, then how to find out the answer. If they give you this particular word, how to find out the answer. Okay? So that's why don't forget to subscribe the channel. Now, after you read the last line, the next one we have is elimination method. Most of the nurses, they know elimination method, but sometimes I have seen they're not using it in a right manner. Okay? Elimination method can be of different types. The first kind I have seen, which is very common, a lot of nurses, they don't know the right answer in the exam, so they eliminate that option first, which they don't know. You know, like for example, they eliminate that option first, which they know for sure that cannot be the right answer. So they eliminate that option first, then they go to the other one and try to find out that option which cannot be the right answer as well. And then they got stuck between two answers, right? So this is the first method. I have seen a lot of nurses using these days. Now the second elimination method, which I'm gonna teach you today, I don't know if you guys are still using it, you're using it, you heard about it or not, but this is how I use elimination method by myself personally to find out the right answer for any question. Okay, so let's see what is my method now for elimination. So the first one here is read one option at a time and compare with the other option. Okay, most of the time nurses, when they come as a repeat test takers to me, I have seen, you know, when I ask them the question, how did you perform in the exam? Like, did you read all the option together in once and all the question together in once? They will be like, yes, we read the question, we read all the answers, we cannot find out the answer, then we read the question, again answers, cannot find the answer, again same story back and back. So I personally think you really need to know how to use elimination method when you finding the answers actually in step 4. So when you using elimination method, remember you really need to control the thoughts of your brain. I know we always get excited reading all the options together, but try your best during the practice time at home when you're practicing any NCLEX style question, always read one option at a time. Okay? And when you read about that particular option, you really need to think, you want to keep it in the question or you want to take it out, right? If you're really confident that cannot be the right answer, maybe it's a funny answer or unsafe for your patient or not relevant to the question. If you already know that this cannot be the right answer, then definitely you can eliminate that answer. Now the rule is, once you eliminate any of the option, the rule is, do not consider back inside that option unless you are 200% sure about it. What does it mean? Like sometimes, you know, we just, being in a rush, we just eliminate the option. But then you thought later, okay, oh, maybe that was the right answer, right? So you only consider back inside if you read about it somewhere and you're 100% sure about it. But if you are just making a guess, it's better not to consider back inside, because I have read it somewhere, sometimes when we are studying for the NCLEX or any examination, what we read it always, it's scientifically proven as well, it's always hiding in our subconscious mind something, right? And sometimes when you're doing the question, if you already very confident that this cannot be the right answer, it's better to eliminate it. So do not doubt on yourself or make a guess answers in the exam or consider back inside once you eliminate some option, right? Now the last thing I want to talk about here is some dangerous and deadly words which you will see in the answer key sometimes, and that helps you a lot in the elimination process, because then you realize like, okay, cannot be the right answer for sure, because you know that you cannot use those words as a part of the therapeutic communication or non-therapeutic communication techniques when you read about those in my lectures. I will be taking like a different series, just so you know. I'm bringing up like your next lectures as well. Like what are those keywords? Once you see in the answer keys, you can easily eliminate that answer as well. Now, as I said always, don't forget to subscribe the channel because I'm bringing all those strategies in the next upcoming videos, which will be very helpful for your exam. Now, let's practice all these steps by using a sample question here and see how to perform it, okay? So the first thing we have is the step number 1. As we said in the step number 1, read the question only once. Now, when we're reading the question in the actual exam, I know we have minimum 85 questions to attempt until 150 max in the NCLEX-RN examination in 5 hours. And sometimes it's so hard to finish the paper on the time for some of the nurses. So I highly recommend it. Try your best to practice at home. Read the relevant information, what you need into the question. Do not read everything, what you do not need actually to find out the answer. You only back to go to the question, something to find out what you actually need in there. Now, when I will read this question, watch me very carefully that how I'm reading this question and which words I'm going to skip actually in here. So it says, nurse is caring for a client diagnosed with paranoid who is experiencing disturbed thought process. I'm going to take a pause here just to show you which words I already missed so far. I have not used the word the nurse because it still says the same meaning, right? Caring for age of the client, 75 years old. I did not even read about it as well because my answer will be still same even if I say here 72 years old or 65 or 55. Paranoid word, I mentioned it, but I did not mention about personality disorder because when I said the word paranoid, I already know in my brain, okay, I'm talking about a paranoid patient, which is a personality disorder, right? So try your best to save your time wherever you can when you're reading the question. I'm not saying totally skim and scan the information and you miss the most important information in the question itself, but just try to read the information what you needed, and it only comes with the practice. Now, once you read the complete question, when making this patient plan of care, which best intervention should the nurse include, you forget about if you understand or if you do not understand. Why I'm saying that? Because we're still going to use step 2, 3, and 4 to understand everything in here. So you basically done first step, right? By using my method, and you must be like, I did not even understand this question as well, what you just read, right? So it's okay if you do not understand anything so far, or maybe you only understand one word, paranoid, that's it, right? Now let's see the step 2. The step 2 here says find the keyword into the question, right? Now the keyword, as we already discussed, this is before the last line, right? So before the last line we have disturbed thought process, keyword is here. Now once you find the keyword, it says read the last line of the question. Why the last line complete information is important here? Because sometimes I have seen they mention something else in the keyword and then they change the last line of the question and change the whole scenario actually. For example, maybe in the keyword it says the vital signs is not stable, but in the last line they mention now after 8 hours patient condition is getting better, right? So last line is very important. And another thing I noticed that there are some words in the last line of the question which can actually change the answer very easily. So those words like first, priority, initial, best, most important, immediately, most concerning. There are lots of keywords like this. And I'm going to bring a separate lecture on those keywords where I will be talking about how to use those keywords by looking into the question, practicing into the question, how you can find out the answer. And I will tell you on that day why they're very important, because literally the answer can be changed just by looking at the word into the last line actually here. Now, when I see the last line here as a student, let's see, when making this patient plan of care, which best intervention the nurse should include, right? So best meaning is what? Now remember, when the word comes most or the best, the meaning is there could be more than one right answer here, but your job being as an RN in this question to try to find out such an answer which you cannot miss, and that is something very important for you to do it in that particular situation, in that keyword, something like a solution to the problem, I would say, right? Very important, or solution to the problem, or you think in your brain, you have to do it. Like you can forget about the other option, but not about this option. So that could be the answer in those cases. And these are mostly those questions I have seen where a lot of time, I would say the students, when they stuck between two different answers in the exam, usually, notice next time, those questions are usually between best, most, when you actually got stuck between the two different answers, because they both are the right answers, right? Now, once you see the last line of the question, the next step, as it says, elimination method. So let's see how I'm going to use it here now. Now, once I know my keyword is somebody is disturbed thought process, and so far you notice I did not even consider paranoid in my question yet in my brain, but while I'm solving this question, why? Because even if the diagnosis is going to be changed here, let's say diabetes, my answer will be still same. So if I have someone with a disturbed thought process, the first option says increase socialization. Why would I do that for someone who is already disturbed, right? This is not going to help my patient or something I have to do it at the end of the day because it says best, and that's not a solution to the problem. Eliminate it. Now, as I said, once you eliminate the option, let's take it away right away. Do not consider back inside because you're already sure. Now, you only consider back inside if you think, oh, I read somewhere, I'm 200% sure I can make it, right? But I'm pretty sure I'm not going to consider back inside. So let's take it away, right? Now, once you eliminate it, let's look at the next option, but I'm not going to read the C and D at the same time. You always think you want to keep it in or take it out. Now, avoid using a whisper voice in front of the client. I would be like, okay, if somebody disturbed, right, I would say it's better not to talk in front of them, the person. Yeah, great idea. Not whispering in front of the client, right? So I'm gonna keep it in this option actually, not just based upon the paranoid, but based upon if somebody has a disturbed thought process. Because there are various conditions in mental health, not just the paranoid, where a patient can be having a disturbed thought process. So that's why I'm saying, do not just rely on the diagnosis because that can be changed, right? Now, once you keep it in, let's compare with the next one. And now the rule, as I said, before you go to letter D, you must eliminate one of these actually. Now, the third one says, have this client include all with all the other clients on the floor. Now, when I see this word all, I'm just going to grab my red marker here. When I see the word all, right, this is one of the deadly and dangerous word. What do I mean with that? Like, this is such a word which we are not really using all the time, right? So I will be very cautious when I'm using this word, because why would I include my one patient with another here for no reason, right? So let's take it away. Now, once you're very confident into that, let's compare between B and D, because C, I already include such a word which I don't need it to be used in here for this patient. Now, the D letter says begin to educate. Again, take it out right away. Why? Because you ask yourself, if somebody has a disturbed thought process, how you can educate someone at that time? And that's a solution to the problem? No way, right? So let's take it away. Second tip over here is, even if you want to read the whole answer, it says social support in the community. When it say educate about this, that means you're kind of talking about giving advice to your patient, right? Did the patient ask for all this support in here? The answer is no. Patient is not asking anywhere, hey nurse, I need to know about this information. Then ask yourself as an RN, why I am including in this option in here? That is not the right answer, right? So only left option here is letter B, which is avoid using a whisper voice in front of the client. So I hope everyone understand how we can use the 4-step technique into the question. This is just the one sample which I bring it up today. Now definitely I'm bringing more classes, as I said. So don't forget to subscribe this channel and use the bell icon, so when I post the next video, which hopefully I'll do it very soon for you, so you do not miss the next continuation lecture. Now, the last thing I want to say is why I bring this technique today in the first lecture is because I think if you got a little bit idea, then you know what type of content you need to study for this examination, or how you can handle the question in a smart way, even if you have not read about the personality disorder, the paranoid, right? So I hope now this is the answer for this particular question. Like, you guys understand why we did this method today, and I highly requested all of you, after watching this video, please try to practice some questions either from your nursing textbooks you're using, Saunders, Lippincott, or Kaplan, or any other you're using. Maybe you're using a QBank in a market. So try your best to apply these techniques in there. If it works, still let me know in the comment section, please, because I would be very happy to know that. Even if it does not work for you, still please let me know, because as I said, I have a lot of strategies like this. Because if one strategy doesn't work with you, I really want to give you the next other strategy, which will be helpful for you to solving a lot of questions, right? Now, if you have any other questions for me, I will drop down my number also, my WhatsApp number, in the description box for you. So feel free to text me on the WhatsApp if you're watching from a different country right now. And yeah, that's all about for this video, and thanks for joining today. I'll see you guys in the next class. Thank you.